Welcome back to West Texas View.
I'm going to ask Dr. Jane to introduce a little video clip we have right now of this magnetic non-medication treatment we have for depression right now. So to set us up for this video we're about to see.
Right. The video actually shows, there has a commentary going on in the video, but basically it involves a chair, which is a sliding chair, and an instrument that has a magnet, a kind of C-shape, kind of little bit curved magnet based on the curvature of the skull that can snugly fit on the head. And it involves a high power magnetic field. So when it placed on it, as you will see in the magnet, it makes a sound like ta-ta-ta-ta-ta-ta sound, and that's the magnetic field that's impinging on the nerves, that's treating the nerves. It involves about 40 minutes of treatment and is known to be quite helpful. The FDA indication, it's
Neuronetics has developed
one trial of antidepressant. There we have the video. Is eligible for treatment of this condition. So very applicable for lactating mothers who are concerned about using medications while breastfeeding. Now this is what we call a magnetic coil that is placed on the magnet. That instrument is the magnet, and this is the chair. We have it where the patient sits, and you'll see in a minute how the patient actually done. So this is available only through prescription. It's an outpatient procedure. You don't have to be admitted in the hospital.
But prescription doesn't mean medicine.
No, not medication. No, not medication. But a psychiatrist has to recommend it. It involves 20 to 30 treatments. It takes about 40 minutes of treatment. Probably less time to get manicure and pedicure. And it involves no anesthesia, no sedation. You are aware and conscious all along.
And no pain.
Well, a little bit discomfort. I would take it back. There is some discomfort available, but not pain. You're right, not pain. So this is what it does. That's me in 20 years from now. I'll be losing all my hair. So that's the area of the brain we stimulate. This is a model patient, and that's the coil, that's the magnet. What he's doing right now is to finding out what part of the brain to stimulate. So it's only a specific part of the brain that is responsive to it. And this is how we find the area. If you stimulate the brain, that stimulates your thumb. And once we find that, there's certain parameters we add to it, and we hit the right area. And this is the stimulation specifics. And what it's doing is, because the head has got a three-dimensional structure, these devices are made, these parameters and all these things are made to stabilize the patient in a particular parameter. And if you can hear it, it making a very almost like machine gun sound, sound.
But not loud.
Not very loud. Even though we take precautions to give some earbuds during the treatment, but it's not loud at all. And that's pretty much it. This is a short version. Of course, it takes 40 minutes to go through the treatment. That's what it is. And it requires 20 treatments.
And so, and that's the cutting edge that has been approved by FDA.
That has been approved by FDA for patients who have failed one trial of antidepressants. There are two other modalities of cutting edge treatments available. One is called the VNS, the vagal nerve stimulation. What really it entails is placing a very small, almost like a pacemaker, in the left, it's implanted on the left side of the chest. It sends signals to one of the nerves that goes to the heart actually, but stimulating that nerve has been shown to be effective in treating depression. And the third kind, which is also cutting edge, is called deep brain stimulation, where we actually make a hole in the hair. That's a pretty intensive surgical procedure where we make a hole in the hair, put a probe inside the brain, reach deep inside the brain that's known to be influencing depression, and kind of stimulate it. Very effective treatment, but still a little bit experimental, but some cases, some centers are accepting patients. So these are the three areas. We don't have deep stimulation, we don't have VNS yet, but we do have TMS, the most benign form, and probably
which is what we just
effective,
saw.
Yeah.
And the interesting, and you still have electric shock if you needed it.
We don't have the center here yet, but it's available to us in the United States.
Okay.
But not at our facility yet.
So to treat to treat depression, a patient would possibly be diagnosed with medication. They would possibly be diagnosed with medication and counseling.
Treated, you mean?
Treated, I mean.
Yeah.
And then the third thing is they would be treated with some of these non-medication techniques that are now being perfected. It is amazing to me how much work has been done in this, and how far we have come in recognizing that depression isn't something you can just cure yourself with positive thinking. You've got to have these things that are not fixed in your body to be fixed before you can do it. And the consequences are so enormous because not only is this an unhappy life with depression, but it makes everybody around them unhappy, and it makes them not succeed in life. And then besides that, it many times leads to suicide.
And if I may tell one thing to our folks regarding the stigma of mental illness, I tell to my patients that if you have blood pressure or diabetes, are you ashamed of it?
That's right.
I mean, why ashamed of getting help with treatment? This condition has very largely influenced by genetics, but that means that runs in the family. So why get treated? Why not get it treated?
Yes.
I mean, you're born with the same color of eyes. It's not your fault. With blood pressure and diabetes, you take medications. Why not take a medication with something which is up here rather than in your pancreas or somewhere in your heart?
Yes, a broken leg is not any more to be cured than something that has been disconnected in your brain.
And you probably have more impairment secondary to having emotional problems than to having a broken leg.
Yeah. And the interesting thing, though, is that we have so many more doctors, but not enough psychologists and psychiatrists. So again, I want to say we are very fortunate to have the Texas Tech Health Science Center here, who has a whole department of psychiatry that's training anywhere from 18 to 30 new doctors, but most of them go out all around and continue with their training. But Dr. Jane is available for consultation and appointments, and so you have seen the number that's rolling across the screen for that. It is such a pleasure to have you here, and I really am looking forward to your coming back and bringing the psychologist with you, and we'll talk about this whole problem. In the meantime, if anyone has any specific questions that they would like for us to ask Dr. Jane and the psychologist that is coming, then we will have some specific questions that we will have available for them. And they'll be back in just a few weeks, and we'll handle that. So in the meantime, it is such a pleasure to have you here, and it's such a pleasure to have Texas Tech in our midst, and we are so fortunate. But tell us anything that you want us to know about how to access you, because we're right in the very end. The number that's rolling across the screen gets your office to make appointments or to ask some questions. They can contact me directly. My phone number, contact number is 432-620-5800. That's the main number. I can leave my email address if something, or on the website that you want to contact. Getting appointments, it's a busy service, so if you're not able to get hold of me, please call and leave a message, or ask them to put you on a waiting list if we are not accepting patients immediately. So as a slot becomes over, we get you invited. Such a pleasure to have you, Dr. Jane. We'll look forward to the next time. Thank you for joining us today. We'll see you next Sunday with another program. Thank you. Thanks for joining us for News West 9's West Texas View with Johnny Lou Avery. This has been a public affairs presentation of KWAB TV and KWES TV.